Some of the common questions that we get for people who have diabetes or even at risk for diabetes is what's going to happen to me? Am I going to get on medications? Am I going to be dependent on them forever? Well, it's different for every person, and it's going to matter what you do, how you treat it yourself. Hi, my name is Dr. Evan Jones. I'm a board-certified family physician who's been working at KANA for the past 10 years. When we talk about diabetes, what is it? Well, diabetes is when your body becomes a little bit resistant to insulin. How does our body work? When we take in sugar, our body has to deal with it in a couple different ways. The sugar goes into our stomach, gets absorbed into our bloodstream, and from there, it either goes to our liver where it gets processed into fat, or it goes to our muscle cells and gets processed into fat. But as that sugar gets turned into fat more and more in our muscle cells, eventually our muscles say, whoa, I got enough fat in here, and it becomes what we call insulin resistant, and it won't take any more sugar. Diabetes is one of many diseases that you do have some control over. There's certainly a genetic part of it, but some of the best treatments we have for it are in your hands. We recommend 150 minutes of exercise a week. Seems like a lot, but if you just do a half an hour 5 days a week, it's attainable. What kind of exercise should you be doing? It's a great question because there are lots of different exercises you may enjoy. That's the biggest number one thing I want you to do. I want you to do what you enjoy because you're more likely to do that day after day. I love hiking and I go for a hike every day pretty much. But some of the better exercises for diabetes is actually building up your muscles. So resistance training is good for a lot of things. I'm going to warn you, when you start exercising, you're actually going to feel worse for the first couple times you do it and you're not going to want to do it. I want you to push through that because you will start feeling better after you start exercising. The other thing I want you to do is I want you to think about cutting out the refined carbohydrates. White flour, white rice, sugar. They're hard to quit. We're kind of addicted to all of those and they taste great. And as you give them up, it's hard, but your body will get used to not having them all the time and you'll find that it's easier to deal with not having them the longer you do it. Our big thing is trying to get your body tuned up so that it can deal with this disease. We can fix this together and we'll be guides on the way. You're still in control. This is your body. You get to decide what's done with it, whether it's medications, exercise, or diet. But we're going to be advisors along the way. And we'd like to walk beside you so that we can come up with a good treatment for you.